Okay, well, I'm Mara Morton Luna with the Gina and Frank Day Health Institute, and I'm so thrilled to have you all here to hear about this amazing opportunity. This is about loan repayments and these incredible mentorship options. And so without further ado, I'm going to pass this on and start the presentation. Thank you.
Hello, everyone. It's so great to have you all on this call and watching the recording. We're going to start with some introductions and then we'll get into the content for today. So first off, my name is Emily Krizmanich, and I'm a workforce specialist for a great organization called Collado Community Health Network. We'll get into the details, but I will pass it over to my colleague to also introduce herself.
Hi everyone, happy Friday. My name is Alyssa Collado, she, her, it, yeah pronouns. I work at the Colorado Department of Public Health and Environment, CDPHE, as the Colorado Health Service Corps, or CHSC, Futures Navigator. Great to meet you all and those that are attending and listening in on the recording. Pass it
Thank
back
you,
to you, Emily.
Alyssa. All right, so just a quick overview for today. You're going to be hearing about the community health centers here in Colorado by me. And then as Alyssa mentioned, she's part of the Colorado Health Service Corps program, and so she'll share more about that. We do have information that we'll share after the presentation about the national program, but we won't be covering that material in this presentation today. So to get us started, I do have a quick poll question for you all. Hopefully it's showing on the screen, but I just would like to know your knowledge of community health centers before the presentation, and then we'll ask it at the end. And it is also totally okay to say, hey, I know nothing about community health centers. We'll see if we can get this going. You can join with the QR code, or you are welcome to do ahaslides.com/MSU25. See someone knowledgeable. Somewhat knowledgeable, great. I like to see the range, and don't worry, I think we'll all learn a little something today, but it's cool to see that there's some knowledge in the room. I feel like we usually see it on the other side, so I'm glad that you all kind of know about community health centers already. And I'm gonna give it just another like 5 seconds, so get your answer in. Okay, I will go ahead and go back to our presentation and get started talking about these amazing organizations. So thank you all for responding. So CCHN, or Colorado Community Health Network, is the membership association for Colorado Community Health Centers. We provide training and technical assistance to CHCs to help them provide high quality care for medically underserved patients, regardless of ability to pay. So this just means that CHCs see patients that are under Medicaid and Medicare, private insurance, underinsured, self-pay, kind of anybody and any kind of coverage options, they can come receive care at a community health center. Community health centers are also really termed federally qualified health centers, but we really like to use community health center, or CHC for short. We do refer to them as community health centers because it really brings us back to the original purpose of what a community health center is, and that's the community. For the vast amount of this level of care, CHCs are the backbone of the nation's healthcare systems. CHCs have national support and are in every U.S. state across the nation and multiple territories, all located in high need areas. So if you're like, hey, Colorado's maybe not my jam, I want to go to California or Puerto Rico or Guam, New York, all of these amazing places have community health centers. So you can do this work anywhere in kind of the US and its territories. And then a really cool fun fact about CHCs is they have to be run by boards that must be at least 51% patients. So this really helps them bring that patient voice, community voice into their operations and into their governing structure. So it's just a little different than what we see in like traditional hospital settings and things like that. CCHN does have a mission to increase access to high quality healthcare for people in need in Colorado. At community health centers, providers are working to treat patients when they're healthy, not just when they're sick. We do have a plan called Access for All Colorado, which aims to provide a home health center for more than 1 million low-income uninsured Coloradoans. Currently, we seek We see enough patients to have, say, 867,000 Coloradoans. We are getting really kind of close to our 1 million goal, but as we like to say, we're not going to stop at 1 million. We're going to then go for 2 million, 3 million, just to make sure everybody is receiving that high quality health care. Now I'm going to show a video. It will also be linked in the slides, but this gives you an opportunity to hear from the staff at community health centers around the state and not just hear me talk for a little bit.
We're out in the plains toward Kansas, and it's a beautiful area out here.
I love the location. I like the fact that it's rural. I love the climate. And this is a very satisfying place to work, and I feel like I'm making a good contribution to the well-being of Americans, and that feels good.
Here we are out in the rural area where people really, really, really need us, and the backup is 3.5 hours away. So you have to be able to practice good medicine and use your head out here.
We are in Los Alamos, Colorado, and I'm a physician assistant, and this is a community health center.
Hello, how are you? I think the people that work in the community health centers are people that want to work in community health centers.
Your hands are cold today.
They have empathy for the patients. They have a real connection with the patient, and they're passionate.
I'm a dental hygienist. I've been here for 16 years, and I just love it here.
It is a culmination of everything that any practitioner could ever hope for, to put it mildly. If you look at the future of medicine, that's what it's coming to. The individual private practitioner is going to be a thing of the past.
So, ¿usted quiere enseñarme?
Working in an underserved area is a huge opportunity. We had no dental services prior to the expansion of the clinic, and this is truly our only first-class medical provider in Bing County.
This is really the leader in information and education of the public in Lamar.
We are cutting edge. We have digital x-rays. We are totally electronic. We don't have paper charts anymore. And when we have new dental providers come in and see our practice, I think that's the thing they're most surprised about is, wow, your equipment is really nice.
Initially, I was hired just as the outreach worker for farm workers, but the job has evolved, and so now we do outreach not just with farm workers, but also with community. So we go out and actually do health screening.
We do a lot of outreach. Probably one of my favorite things about working at a community health center, though, is that my day is so different every day.
You can get the relationship that you would like to develop with a lot of the patients that you couldn't develop in another area.
Oh, I love it. It's close to where I live.
People really, really, really appreciate the care they get here. They walk in the door, it's a full meal deal. You know, you don't have to go hither, you don't have to go yon, it's all taken care of right here.
We're able to really spend the time that we need with our clients, and me as a professional, I'm able to make the decisions that I need to treat that client correctly and get them healthy.
It's a good way to come in an area, work, practice, and then get your loans paid off at the same time, where you won't have that burden to deal with.
There's loan repayment available for people who are graduating. That's really attractive.
It's real peaceful. Once you get off work, you don't have to deal with traffic, and all the things that you want to do is very accessible. That's one of the things I like about being in a small area.
We've had a lot of successes here with helping people make the changes that they need to change, which are hard to do. So yeah, I get a lot of satisfaction out of that.
I love going into the grocery store here in Lamar, and the kids are excited to tell me that they brushed their teeth this morning, and I remember you came to my school. To me, that really hits home and keeps me going every day.
You better jump on the bandwagon here real quick, because people are going to find out about CHCs, and there's not going to be many places left. And I'm not leaving, I'll tell you.
The patients, I mean, their gratitude is just unbelievable. Working in this setting is just very, very fulfilling.
This was a dream job for me. I love it. Love it.
All right, thank you all for watching that and hearing from some of the providers and staff at community health centers. Next, we're going to talk about some of the exciting programs CHCs are providing to both staff and patients. So one thing that's really unique about community health centers is they have integrated care. So they have medical, dental, and behavioral health at their sites. And then we also have some providing pharmacy and vision services as well. All of these services include health promotion, disease prevention, counseling, education, diagnosis, and treatment of acute and chronic illnesses. CHCs offer enabling and outreach services as well, and this can include transportation support. So you might have a patient that says, hey, I would love to come talk to you or have my dental cleaning done, but I can't get there. I don't have a ride. I don't have a way to and from the clinic, especially in rural areas. And so many community health centers provide that transportation support at no additional cost to the patient. CHCs also offer WIC and Medicaid setup services and other methods that ultimately increase access to care and improve community health outcomes. We know that community health centers are leaders in delivery of primary and preventative care. In Colorado, 23% of Medicaid enrollees and 21% of CHP Plus enrollees receive care at a community health center. A recent study found that community health center Medicaid patients had 24% lower costs of care when compared to patients in similar settings. And so that really just shows not only we're providing integrated, high quality, affordable health care, but we're really trying to reduce those barriers to care by making it cheaper. All of these services do increase access, which helps with community health outcomes. That's a direct connection between the two. And working at a CHC, you're not just going to be doing a job. You're going to follow a mission that allows you to provide care to people that may not have any other options. Within health centers, you support those who are high need without ever having to leave your community. In addition to integrated care, they also do team-based care. This ensures that every member is able to work at the top of their scope and providers are able to focus on what they do best. Well-implemented team-based care has the potential to improve the comprehensiveness, coordination, efficiency, effectiveness, and value of care. It also improves the satisfaction of patients, providers, and just staff generally. So the way to think about it is team-based care is your doctor is going to talk to your pharmacist, who's going to talk to your dentist and your behavioral health provider, and they're able to pull those people in when needed and things. And so you have multiple providers kind of looking at your chart and looking at you as a holistic person and not kind of separate out into different practices and things like that. So it's a really cool model. CHCs use integrated care teams that are comprised of a variety of staff that include, doctors, physician assistants, behavioral health providers, medical assistants, dietitians, dental hygienists, front desk personnel. Like that list can go on and on and on. CHCs are also pretty forward-looking. This includes fully electronic health records, which isn't surprising in 2025, but they also are working on various projects that will improve the health of their patients. And CHCs provide affordable, efficient, and coordinated care all under one roof, and staff are always looking at how they can improve, grow, and develop as well. And as Alyssa knows, I do really love maps, and I think this gives a really good view of community health centers in the state. So as you can see from the map, they are all over Colorado. They're in 47 counties, which is that gray color that you see, but they care for patients in 63 of the 64 counties in Colorado. So if a county doesn't have a community health center, but they're serviced by one in a neighboring county, then they have the little gray slash on their county. But you can see that they are all over the place. Colorado CHCs offer behavioral health on site at 200 plus clinics in 42 counties and dental services at 130-ish clinics in 41 counties. So, and as I stated earlier, CHCs serve over 867,000 patients in Colorado. So they have a wide reach across the state. And CHCs are located in rural, urban, and frontier sites, so you can live almost anywhere in the state and work at a community health center. Now, to talk about how this can all benefit you all as future clinicians and future people working in healthcare, working for a CHC is like being a part of a bigger family. And we're not just talking with the staff that you work with every day. We're talking about the community as well, because you become an integral part of the community. In Colorado, CHCs employ more than 6,400 staff and support more than 5,000 jobs in other businesses in Colorado. So they have a big impact on the economy as well. CHCs offer robust benefits, including continuing education dollars, vacation, sick time, medical, dental, like wellness benefits. I like to point out ski passes, because we do have one health center up in Frisco that offers a ski pass as part of their wellness benefits. So if you're into the skiing, snowboarding lifestyle, they can be a great option for you. And then they have so many other benefits. It would be impossible to list them all on the slide. Staff can provide care and still make it home for dinner with family or friends or your furry pets, whatever it may be. CHCs do support a good work-life balance, which we love to talk about. Also, CHCs qualify for the National and Colorado Health Service Corps programs, which you'll hear about the Colorado program soon shortly. Also, something that's cool is CHCs do pay for malpractice coverage through a government program called FTCA. I won't go more in depth, but that is an option. CHCs also offer multiple work schedule options. So you could have a 32-hour full-time work week. You could have flex schedules and flex time. Or if you're like, hey, I'm in for the traditional 9 to 5, that is also going to be an option. You just kind of work on your schedule during the hiring process and like when you're onboarding at a community health center. We also see that there are many opportunities to grow and lead within the clinic and within your community. So providers can move up to places like chief medical officer shortly after they complete their loan repayment service obligations and kind of become that leader for staff and the community. And then CHCs offer competitive salaries. In June of 2024, we completed an annual salary survey. And so I know we've got a range of people, so I'm going to just throw out some average salaries. Hopefully it works with you and what you're looking for. But a physician assistant averages about $121,000 annually. A licensed social worker is about $81,000 annually. And a physician without OB, so no obstetrics duties, averages about $221,000 annually in the community health setting. So I'm going to stop talking in just a minute and let Alyssa share about her program. But I just wanted to say that if you're interested in working with a collaborative healthcare team where you share a sense of purpose and mission, CHCs are going to be an excellent fit for you. If you'd like to know about what current job openings there are in CHCs, sign up for our job email or learn about CCHN and CHCs overall, please scan this QR code. It has all that kind of information in it. And then CCHN's contact information is at the end of the presentation. So feel free to reach out if you have any questions or would like to get connected into the health center movement in any way. And so I'm going to pause here and see if there are any questions now that I can answer. All right, I'm not hearing any questions and I'm not seeing any hands. So I will go ahead and just say thank you all for listening to me talk about the amazing thing that is community health. I will also say the slides that you will get from the presentation today do include information about the National Loan Repayment Program. It's called National Health Service Corps. We will be skipping over the information during the presentation, but please feel free to reach out to us if you have any questions or if we can connect you with our contact. I also just want to call out that there will be information about this program because a bunch of their applications are open currently. So for different loan repayment applications, if you're in nursing, there's a nurse scholarship program whose application is also open. So please check it out soon. I'll make sure the slides are over to Mira today, but I will stop and pass it over to Alyssa.
Hello, everyone. Yeah, thanks y'all for joining us and for spending time just understanding the value that is the Colorado, like just FQs in general. Community health centers are some of my favorite places in the world. I used to work at an FQ for about 8 years in the dental health administration kind of field, and it changed my life. It made me want to pursue this particular position and try and recruit clinicians into working in the coolest place on earth. So before I get started, I'd love to invite everyone to just kind of shoot in the chat, like what healthcare career or discipline are you all aspiring to? I can kind of hold in for a second. Do you want to be a nurse? Ooh, mental health. Jason, yes, that's so needed. Clinical social work, Nikki. Oh, also so needed. Ooh, LCSW's in the house. Y'all, so important. That's great. I'm so glad to hear that. Especially as we start talking about the eligible disciplines of our program. Social work, rock on. Awesome. That's so fabulous. This program is going to be perfect for you all. Anyway, yeah, I'm Alyssa. I know I mentioned that earlier. I work in the health access branch at CDPHE on projects to promote and advance health equity across the state of Colorado. So really proud of the work we do in the public health department, and psyched to chat with you all today about an innovative pilot program that we are in the middle of. It's our very first year, and I'm psyched to bring this information to you all, yeah, in our first cohort. So on the next slide, I'll just kind of cover what our agenda is going to look like. I'll share a little bit about our parent program, the Colorado Health Service Corps, its history, its mission, the success rate of that program. I'll share a little bit about why we are opening this program to health profession students up to 11 years prior to receiving your license and joining the workforce. And then we'll break down the various elements of that program. So we'll talk about what the pre-application phase is. I'll talk a little bit about the contract and the application that's opening in the summer. And for those of you that want to get involved, share any and all information that I can and answer any questions that I can about getting connected to this work. On the next slide, my objectives. So by the end of our meeting today, my goal is for everyone on this call to understand what the Colorado Health Service Corps is, what its benefits are, understand sort of what the responsibilities of being a part of the CHSC include, some of the application requirements, and then again, for those that are interested in participating, making sure that you're set up for success to do that. So first and foremost, on the next slide, what is the Colorado Health Service Corps? As I mentioned earlier, it was born in the Public Health Department in the Health Access Branch as a health equity program and project. Our main objective is to increase health access amongst clinically underserved areas in Colorado. So first and foremost, we want a healthier population, and we use loan repayment to do that. Our incentive of up to $120,000 for a 3-year service agreement has been 99.5% successful since the birth of this program in 2009. It's a legally binding contract between you, your employer, the state of Colorado, to commit to working in clinically underserved areas, making a difference for underinsured Coloradans, publicly insured Coloradans, yeah, across all four corners of our state. So I'll get to show you one of Emily's favorites, a map a little bit later, but that's the bulk of our program. And y'all, please feel free to shoot any questions you have in the chat as you have them. I want to introduce you all to a couple of clinicians that work in the CHSC, serving in various areas of Colorado. Lorena Rodriguez is a hygienist that works out in Craig, and serves her community as one of the only oral health professionals in her hood. And Dr. Sophie is a pediatrician that works in the Metro Denver area. They have a way easier time sharing their experience as a clinician in the CHSC, and so I'd love to take 6 minutes to just hear from them on what it's been like to work in the CHSC network.
I was born in Mexico and I grew up in Craig, Colorado. Growing up, I did the housekeeping industry with my mom. I was 10 years old when I started cleaning rooms, helping her make beds. I saw my mom working so hard, but still struggled to even get her teeth cleaned. And I felt like one day I would like to change that.
I am first generation Ethiopian Eritrean American. When I was 7, I went to Ethiopia for the first time and saw some children who had been born with deformities or had injuries from wars, homeless on the street. And I just asked my mom how come they couldn't get health care. And she would just look at me and say, "Oh, Sophie, it's not that easy." And that really stuck with me. It's why I became a pediatrician for the underserved, and it's why I'm really proud to have gotten to participate in the Colorado Health Service Corps.
So Colorado Health Service Corps was really born and developed out of a need to improve access to care in underserved parts of the state. People that live in rural communities often live at great distance from many of the healthcare services they need. In our urban communities, sometimes the barriers experienced by people are more related to income and health insurance. And so we collaborated with non-governmental partners and with clinicians who have a specific interest in meeting the needs of underserved populations, and we work together to achieve those access goals.
As a pediatrician working in a safety net clinic, you go home every day knowing that you are making healthcare better and you are affecting the lives of people and children in your community.
Living in a small community, you know everybody knows you. I like to talk to them and, say, come and see me, bring your kid. And if they have any question teeth-wise, that does not bother me at all.
They really see you as more than just their healthcare provider. You become a part of the family. I know when I call some parents to follow up on labs or ask a question, you hear the kids in the background, "I want to talk to Dr. Sophie." And the parent is like, "She doesn't have time for you." And I'm like, "Put them on the phone. Why not?"
Now, my teacher does that.
I love it. It's okay, you're 4. You have time to figure that out.
That connection I have with my patients, it's so important to me. I work with a lot of patients that never had their teeth cleaned. I had patients say, "I always have to go like this when I want to smile," and now I'm like, I can smile. I get tears and it just makes me really happy.
We have about 800 clinicians in our program right now, and more than 2/3 of the clinicians end up staying in the communities that they serve. And so we know that just in terms of the output of those clinicians, that our impact has been substantial.
The patients that we serve come from really diverse backgrounds, ethnically, racially, religious, language. What I think many of them are looking for is that we can connect along those lines. I have a lot of East African patients who come to me specifically because my family heritage is East African.
There's just a lot of Hispanics that they're so scared of going out there and maybe getting people that don't understand them. I feel like me working here, the Hispanic community is taking better care of themselves, not just health-wise, but dental-wise as well.
As a woman of color, I understand what it means for patients to be able to see themselves in their physician. I know where they're coming from, so I think that closes that trust gap. So this is a note I received from a high school student after presenting there about becoming a pediatrician. You are unapologetically a Black female doctor, and I aspire to be you. That's really cool.
It's so important to have diversity in healthcare because our communities are so diverse.
The quality of clinical care improves and the health status of people improves when patients have a range of options for clinicians. And sometimes patients are more comfortable with clinicians from a similar culture or similar racial background. So there's a real potential here for improving quality and access by improving the diversity of the Colorado Health Service Corps.
I always knew I wanted to serve this population. The big question was how to do that and pay off all my school loans. And the answer was the Colorado Health Service Corps with their loan repayment program.
We reduce the burden of those student loan payments and that long-term debt so that they can follow their passion. We've really created a win for both access to care in those communities and a win for that clinician.
It made a big difference on me and my dreams, you know. It was such a nice opportunity, and I'm so grateful, honestly.
The best candidates for Colorado Health Service Corps have a spirit of service, a deep desire to meet the needs of people that experience high barriers to healthcare services, and they're likely to have a successful integration in the community that they're working in and stay long past the time when their state contract is concluded.
If you're someone that wants to make a difference, you're needed here in these communities all across Colorado.
For anyone interested in serving this patient population, you should really consider the Colorado Health Service Corps. Bring your diverse backgrounds and experience to the Safety Net Clinic community and help better represent and better serve our patients.
On the next slide, just kind of want to share a little bit to tie into what Dr. Sophie and Lorena were sharing during our video. Diversity in healthcare really matters, and the Public Health Department aims to increase diversity amongst the Colorado Health Service Corps by thoughtful outreach. So having the ability to share this information with individuals like yourselves, talk about the benefits of the program, not only for you as students, but also for the patients that are going to be receiving care from you in the future. Your lived experience and background makes a difference in the lives of individuals that are accessing healthcare, especially mental health, y'all. I know for myself as a second, third generation Nuyorican, having a therapist who also shares that background and cultural experience makes accessing healthcare much easier for me. And I've seen it working in community health centers throughout my career. And I'm just so grateful for all of your heart to continue doing this work, and for bringing your unique selves and experiences to our patient population in Colorado that really need you. So what we're kind of sharing about is not only the opportunity to join the Colorado Health Service Corps early, up to 11 years before you receive your license and join the workforce, but we also are offering mentorship and program education in our pre-application phase to hopefully give you any and all information that you would want or need before submitting an application with the CHSC. So on our next slide, I'll kind of break down the different components of the program. Friends, we are currently engaged in the throes of the pre-application phase. So if any of this information has sparked curiosity in you, I would highly encourage you engage in this program. we're currently offering 6 e-learning courses that are 25 minutes or less. I promise you, if they take you 26 minutes, you can call me personally and we can work on reducing the content to make it easier for you. Our goal is to provide you with all of the information that you would want without overloading your schedules, because we understand that you likely have a lot going on. So yeah, you've got to take those 6 e-learning courses. We offer mentorship with individuals that are serving in the safety net clinic community and have received either Colorado Health Service Corps loan repayment, National Health Service Corps loan repayment, or the state dental loan repayment program, to give you a better understanding of what it's like to work and serve in the CHSC. These are prerequisites, so you have to take all 6 courses prior to submitting an application this summer to participate in our first cohort of the CHSC Futures program. So July 2025, next couple of months, the application will open. It will stay open until September 30th. And during our advisory council meeting that selects our traditional Colorado Health Service Corps clinicians, we will work with that group to make a selection of the first 20 participants to sign contracts with us up to 11 years before you graduate and get your license. So that's the program at 30,000 feet. I'm gonna kind of dial in just a little bit closer into the various parts of the program on our next slide, just to give y'all a preview of the courses that are offered. The first 3 courses are launched and live and available to start taking. I will link that learning series in the chat for you all. The first course gives you all of the information, sort of overview of the CHSC Futures program, and includes resources that you would need in kind of understanding high level what Futures is. The second course is a contract specific course. So it'll teach you about what required hours you need to serve in the CHSC, contract specifics, like what if I need to take family medical leave while I'm under contract? Or what if I move out of state? What if I decide that I want to switch jobs? We'll cover a lot of those specifics in month 2. Month 3 offers information on available loan repayment programs that are like Colorado Health Service Corps, scholarship programs that are available to students that are pursuing healthcare degrees, and other state programs related to healthcare that will also have lots of resources and documents and things that you can download, links to websites like the National Health Service Corps, which y'all will get slides for when we send you our slide deck. But yeah, all information that we know about that can help finance your education will be covered in month 3. Month 4, we'll dive into the why of our work. So we'll share with you all both data and qualitative storytelling on how a diverse healthcare workforce has made individuals healthier. These will be related to the state of Colorado, and we're so excited to get to share these stories. And yeah, just celebrate the work. The 5th course provides a picture of what it's like to work in the safety net clinic community. So we've broken down this course by what it's like to live in rural communities, frontier communities, and urban communities. In this course, we also have links to job search sites if you're interested in working in the safety net clinic community. Lastly, the Charting a Path Forward provides any and all insight on the application process. So you'll receive information on timelines, the link to the application, what we're going to ask you, what required documents you need. All of that stuff will be covered in the 6th course, just in time to submit your application in July. So those are the e-learning topics that are covered in Futures. And during this time, you'll have access to your mentor to meet virtually and ask all of the questions that you need to get connected to in-person resources if needed. Anything that's going to help you along your journey. We want to all be here to support you. And I include Emily from CCHN in that. She's been very heavily engaged in helping with organizing shadowing or internships or kind of helping us navigate the job site. So thanks, Emily, so much for all the support you provided so far. Anything that your mentor can't answer, we'll work together to get answered for you. So that's the pre-application phase. Once you've met with your mentor, you've taken all 6 courses, you can decide at the end of this pre-application phase that it's not for you at this time or at all and not submit your application without any repercussion. So this is a free program. You can engage in and out of it based on what meets your needs. Just know that in order to submit an application, you have to have all 6 courses completed. The next slide, we'll talk about eligibility for Colorado Health Service Corps. This also applies to Colorado Health Service Corps Futures as well. So you first have to have student loan debt to be eligible for the CHSC, though there are some programs that pay for living costs and expenses and books and those kinds of things. The Colorado Health Service Corps is very specific to paying off and alleviating the burden of student loan debt. It has to be your student loan debt, which means you're not consolidating your student loans with your personal loan or your partner's student loan. Parent Plus loans are also considered ineligible loan debt. Also, your loans have to be related to your current healthcare licensure and also remain in good standing. So if you've met those requirements, you can pass on to stage 2. You have to work at an approved Colorado Health Service Corps site in order to receive the loan repayment award from us. Sites have to apply to be a part of the Colorado Health Service Corps just like clinicians do. And they essentially demonstrate to us that they serve the population that we are aiming to serve in the state of Colorado. Are you welcoming patients regardless of their ability to pay? Are you offering them a sliding fee discount? Those are some of the criteria that we look for, though not all. We do have a list on our website of approved sites if anyone's ever curious of what sites are currently approved. Lastly, you have to work in an approved CHSC discipline. So many of you all that listed social work and mental health, that's great news. Those are eligible disciplines for the Colorado Health Service Corps. If you know of a physician assistant, dentist, dental hygienist, psychologist, nurse practitioner, advanced nurse practitioner. So this is also like certified nurse midwives, psychiatric nurse practitioners, addiction counselors, clinical pharmacists. Y'all don't be selfish. Share this information with a friend if you think that they could also qualify for the program. When you receive the slide deck, the hyperlink in the bottom left-hand corner will take you to our traditional Colorado Health Service Corps website with information on eligibility. So if you're ever curious, you can follow that link and explore the website. On our next slide, we'll take a look at where you can serve in the state of Colorado. These blue dots indicate approved Colorado Health Service Corps sites across our beautiful Colorado landscape. There are rural, frontier, urban practice sites available for you. There's an interactive map on our website that you can hover over these blue pins and sort of see what approved sites are available in addition to a PDF list on our website that you can explore. As Emily mentioned, the Colorado Health Service Corps, so this specific program does require clinicians to serve in the state of Colorado. The Exploring Similar Programs module, as well as your slide deck that you'll receive, will provide you information on the National Health Service Corps program. And like Emily said, you could go to Puerto Rico, you could go to Guam, Virginia, anywhere in the US states/territories. So be on the lookout for that information in Exploring Similar Programs and also in your slide deck. On the next slide, we'll talk about the time commitments that we offer to clinicians that are interested in serving in the CHSC. You can work a flexible schedule, friends, and also receive a salary at the same time. So receiving this loan repayment benefit is in addition to working in your normal job and receiving your normal salary. Committing to a full-time obligation with the Colorado Health Service Corps requires you to work 40 hours a week. 32 of those hours have to be dedicated to serving patients in direct clinical care. So that could be face-to-face patient time, that could be charting, it could be referrals, anything that you're doing to support your patient and receiving the care they need counts toward direct clinical care. Though there are definitions on our website if you're curious. Working that type of schedule awards clinicians between $90,000 and $120,000 based on what clinician type they are. So physicians and dentists receive the $120,000 award amount for a full-time obligation. All other health professions receive $90,000 for full-time. So that does apply to behavioral health and social work. Agreeing to work a 3/4 time obligation will provide 75% of the full award, and part-time obligation provides 50% of the full loan repayment award for a 3-year service agreement. Individuals that have debt beyond their 3-year service agreement are welcome to apply for a 1-year renewal with the Colorado Health Service Corps. You can do that up to 5 years and receive up to $30,000 a year for those annual renewals. You can apply for additional loan repayment programs like the National Health Service Corps program, the Indian Health Service Loan Repayment Program. Shoot your shot, apply for all of them. If you get accepted for all of them, know that you can only serve one contract at a time. So just kind of keep that in your landscape as y'all are looking at some of the courses or thinking about some of these loan repayment programs to finance your education. So that's what you sign up for when you are a licensed clinician, when you have a job at an approved CHSC site. This is what our traditional CHSC program looks like today. And applications are open for clinicians March and September that are already working in approved CHSC sites. The next slide is what Futures offers. So imagine the service obligation phase, so that far right hand phase is what a traditional Colorado Health Service Corps clinician serves today. What Futures offers are 2 steps backward. Educational obligation phase offers up to 8 years to complete whatever required education you need to serve in the discipline that you would like to serve in the CHSC. Semi-annually, we'll check in and make sure that you're studying the same thing that you want to be studying and are on track to graduate, and we're able to offer any and all resources. When you graduate and you're ready to start your internship or you're under supervision and getting hours, or you're taking your boards, fellowships, all of that stuff occurs in your licensing obligation phase. You have up to 5 years to get your license and find a job at an approved CHSC site. Though the CHSC will point you in the direction of where to find approved jobs, we don't offer job placement. So once you get your license and you're employed at an approved CHSC site, you join the service obligation phase, serve your 3 years, and meet the required hours of direct clinical care during that time. Semi-annually, we'll check in on the impact in your community. How many patients have you seen this 6 months? What were they like? Do you have any cool patient stories? Those kinds of things will get kind of compiled in a semi-annual report. And once your contract concludes in your service obligation phase, as I mentioned, you can go on to renew if you have additional loan debt or pursue additional loan repayment opportunities, whatever is going to be best for you.
Alyssa, we have 2 questions in
Yeah.
the chat.
Thanks, Mira. That's perfect. I was going to pause here too. Great. So Nikki, does direct clinical care include in-person and telehealth-based services? No, the great question. I have not addressed this yet. And though direct clinical care aims to offer flexibility with telehealth, a majority of what we're seeking is face-to-face patient care. And I will find in just a second the definition really quick of direct clinical care for you. Does that answer your question, friend? Okay, awesome. Thank you. And Madeline, so the Futures program is different from the normal. Yes, in that we are funded for the Futures project through a private foundation called the Colorado Health Foundation, Madeline. This is carved out specifically for Futures clinicians. The obligations are the same once you're in the program and working. So the service obligation phase for a Futures clinician looks just like a traditional clinician. However, the funding that we're sourcing this from is something that we intend to set aside for every clinician who's accepted into the Futures program for when they are ready to enter the service obligation phase. So once you start your job at an approved CHSC site, we will issue a tax-free lump sum award amount that is both addressed to your lender and to you to pay back right at the beginning of your career journey. So right at start, so that we can avoid any payments or interest, those kinds of things. Did that answer your question, friend? Awesome. Awesome. These are great questions. Yeah, I'm glad that this is sparking curiosity. And lastly, friends, I just have 2 more slides for you. If this presentation has intrigued you at all, I'd love to just kind of level set, ask 3 questions, and determine if Futures is the right vibe. Do I have a passion for meeting the needs of people that experience high barriers to healthcare services? So if the answer is yes to that, please memorize my name. I'll make sure my email's there. Call me, beat me if you want to reach me. We want to really recruit folks that are interested in serving our populations that are most vulnerable. It's not easy work. It's not for the faint of heart. It really is for folks that are committed and want to really make a difference. Is it easier to work in private practice? Probably yes. Yeah. So you really have to know if that's something you want to do. Will I be committed to the community I'm serving long past the time when my contract concludes? So again, this is really about serving our community. The loan repayment is the carrot. We want for folks to have a relief in student loan debt so that they can focus on the most vulnerable population in Colorado, and really, really encourage folks to approach this program with our mission in mind. The loan repayment's a benefit. The health access that we're creating in our community is really what we're looking for. And also, do I have a desire to provide on-site clinical care? So if you've answered yes to all three of these questions, please, please, please scan the QR code that's going to be on the next slide. If you've answered yes to half and are still on the fence, please feel free to explore our website or reach out to me to meet, to ask questions. I live in the Denver metro area. I can meet for coffee or virtually over the phone, whatever works for y'all. And if you said no to these things, we can still be friends, but Futures probably isn't the right program for you, and that's okay. Yeah, we want to be able to offer this information, and if this has sparked anyone's curiosity and you think, oh man, I think I might know someone that could be really good for this, again, I challenge you to share this information with a friend. On the next slide, just a couple of ways y'all can engage with us. So you can scan the QR code on the screen to start taking your matching survey. This will automatically enroll you into our mentorship program and start sending you links to the e-learning courses that are required to submit your application. The Futures website has a lot of great information if you're curious about anything that I've said during our presentation today. We also have a link to the learning series that is required, and you can get connected to the mentorship program through that as well. And my email. So if y'all ever just have questions or want some clarification before moving forward, I'm here, happy to answer questions. So thanks y'all for your time today. A Friday afternoon during lunchtime. Goodness, we're so lucky. Yeah, so I'll pass it back over to Emily and just kind of be here for questions if anyone has any.
Thank you,
know-
Alyssa. Oh, go ahead, Mira. Sorry.
I was just going to say thank you both. I know if anybody has any questions, we probably have time for one or two more questions, but I know we've got this recorded and you have the contact information here. Any last questions?
Well, I have a question for all of you because I said I would do it. Now rate your knowledge of community health centers as you kind of mull over any questions for me or Alyssa. Yes, friend, would you like to ask a question?
Yeah, I do have a question. So I was looking at the website. It says you have to be licensed at the time of application, and I'm wondering, because yeah, I'm pursuing the LCSW. I'm graduating in May, so I'll get the LSW license. Is that like a qualifying license, or do you have to be at the LCSW license?
Madeline, great question. Sorry, I just sent something in the chat and I don't know what kind of trickery I just did, but I'm gonna link the Futures site for you as well. Hold on a second. Futures program in the chat. What I think is on the website, CDPHE's traditional website, is our CHSC program that serves licensed clinicians. So the Futures program has a different website. I dropped it in the chat for you. That one has more information on like what qualifications for Futures, and that you don't need a license for.
Okay, thank you. So for the non-futures program, a licensed social work license doesn't count. It has to be the LCSW.
I will double check. I believe that there are eligible health professions with like specific qualifications on our website. Let me find the link for you really quickly. Prospective applicants. Eligibility. Here we go. Yeah, Madeline, I will drop that in the chat for you.
Okay, thank you.
Yeah.
Well, I think we are at time. I encourage you to reach out. This is an exciting program. On the slides, again, they have the contact information. Alyssa, thank you for dropping that in the chat if people want to look at that. And with that, I'm going to stop our recording and end our session. Thank you all for joining.
Thank you all.